Attributing his success to an exemplary memory and the stimulus of new challenges, Dr. John Linfoot first recognized his interest in becoming a physician as early as 6 years old. On one particular Christmas morning, he excitedly rose from his slumber and hurried into the living room to find a pile of gift-wrapped boxes and ornate bags with bows attached to them. As Dr. Linfoot opened one present after another, he eventually discovered a toy doctor's kit and was immediately enthralled by the plastic medical equipment. Even as a child, he resolved to pursue a future in medicine and stuck with his decision all throughout his higher education. Presently, he boasts a successful career with more than 60 years of medical practice to his credit. Initially enrolling at the University of North Dakota, Dr. Linfoot first obtained a Bachelor of Arts in 1953 and then a Bachelor of Science. Thriving under the pre-medical program at this academic institution, he earned a Master of Science in Physiology and Pharmacology in 1955. Subsequently, he relocated to Massachusetts and graduated from Harvard University with a Doctor of Medicine by 1957. Following his departure from Harvard University, Dr. Linfoot began building a reputable resume and ascending the upper echelons of the medical field. Initially an intern at the University of Utah affiliated hospitals, he conducted a residency and multiple fellowships until he secured his position as a chief resident with this healthcare network in 1961. That same year, he started contributing his expertise as a research associate to Donner Laboratory until 1978. Afterwards, he acted as the director of Bay Reference Laboratory from 1979 to 1982. Exhibiting a particular penchant for the study and treatment of diabetes, Dr. Linfoot served as the Director of Diabetes and Endocrine at Providence Hospital, as well as the Diabetes and Endocrine Institute Summit Medical Center from 1985 to 1993. An expert in this medical discipline, he spent years diagnosing and treating patients suffering from ailments such as diabetes, osteoporosis, thyroid cancer, Graves' disease, Addison's disease, and Cushing's syndrome. Additionally, he oversaw the progress of forthcoming students and enlightened them on the lesser-known functions of the endocrine system. Since 1992, he has excelled as the Medical Director for Health and Nutrition Technology, as well as the Director of the Diabetes and Endocrine Institute. Aside from his official titles and posts, Dr. Linfoot has performed at subsidiary capacities for additional laboratories, hospitals, and universities. Over the years, he has lectured and presided over lessons as a guest instructor at the University of California Davis School of Optometry and the University of North Dakota. Likewise, Dr. Linfoot lent his capabilities as the Director of Endocrine and Metabolic Services at Alta Bates Hospital. Additionally, he assisted in the development of hormone testing and directed programs concerning pituitary tumors, metastatic breast cancer, and retinopathy as a senior staff scientist at Lawrence Berkeley Laboratory. Though Dr. Linfoot is a physician in high demand, he still finds time to supervise educational programs at the Veterans Clinic and mentor physician assistant students at the Merit School of Nursing in Oakland. Most notably, he has treated 385 cases of acromegaly, a considerably rare hormonal disorder that occurs in adults when the pituitary glands produce an overabundance of growth hormones. Usually caused by benign tumors, the bones of the body, particularly in the hands, feet, and face, increase in size to the point of discomfort and may cause complications in conjunction with diabetes and high blood pressure. As a means to combat this condition, Dr. Linfoot tested a method known as a pneumoencephalogram. This process draws fluid out of the spinal column and replaces it with small amounts of air to determine the presence of tumor growth. As patients were extremely uncomfortable with this type of testing, he instead surrounded the pituitary glands with air and was able to determine that hormone levels were higher in the spinal fluid than the bloodstream when tumors were present. As the advents of CT scans and MRI were not yet available, Dr. Linfoot's approach garnered him a lauded reputation in the medical community for his ingenuity. Throughout his tenure, Dr. Linfoot has maintained civic responsibilities as a member of the Professional Advisory Board for the Easter Seal of Contra Costa County, the president of the Alameda Contra Costa Diabetes Association, and the chairman of the Coordinating Deacons for the Orinda Presbyterian Church, to name a few. Owing to his efforts, Dr. Linfoot has been recognized as the 2016 top doctor in Lafayette, California for his feats in endocrinology and nuclear medicine. Top doctor awards are bestowed upon physicians who consistently provide exceptional health care to patients and have upheld clinical integrity throughout their careers. As a testament to his professional success, Dr. Linfoot is featured in a past edition of Who's Who in Medicine and Healthcare.